Welcome to the deep dive. Today, we're getting into something really fundamental, touching, well, both our health and our finances.
That's right.
What do Americans really think about medical treatments today? We want to look, beyond the usual headlines.
And for that, we're diving into a really key source. You shared this survey from the Pew Research Center. It's great because it asks Americans directly about how they see the value of treatments versus the costs.
Exactly. So our mission here is pretty clear. We're going to unpack the main findings for you from this survey.
Yeah, pull out the bits that maybe surprise you, where people agree, where they disagree.
And figure out what it all tells us about, well, the whole healthcare picture in the U.S. based just on this data.
And right off the bat, there's this kind of paradox, isn't there?
Yeah.
People are really divided on the basic value of treatments, but almost everyone agrees on one specific huge problem.
Okay, let's dig into that division first, that headline tension. So the survey finds Americans are split almost right down the middle. You've got 48% saying medical treatments are worth the costs because they allow people to live longer and better quality lives. But then 51% say they often create as many problems as they solve.
Wow, 48 to 51. That's incredibly close. A virtual tie.
It really is. But then you put that right next to another finding.
And this is where it gets fascinating. Despite that split on value, a massive majority, we're talking 90%, think science has had a mostly positive effect on healthcare quality.
90%.
Huge number. And the survey even mentions, looking back at 2016, that healthcare and medicine were the top reasons people gave for science having a positive impact overall. Like 59% mentioned it.
Wow. So, okay, let me get this straight. People overwhelmingly trust and value the science behind the medicine.
Yes, seems so.
But they're literally split down the middle on whether the treatments themselves are worth the cost and potential downsides.
That's what the numbers suggest. A real belief in the engine of medical progress, but maybe some serious hesitation about the final product, or perhaps the system delivering it.
Interesting. So digging into that 48-51 split on value, does it break down along predictable lines, like politically?
Well, that's another surprise. Politically, not really. The survey shows Republicans and Democrats are actually quite similar here.
Oh.
Yeah, about 47% of Republicans and Republican leaners say treatments are worth the cost, compared to 50% of Democrats and leaners. So, not a big partisan gap on that specific question.
Okay, so politics isn't the big driver there. But you mentioned the source points to something else, income.
Income, yes, that's where you see a really significant divide. It's quite stark, actually.
How so?
Well, among upper-income folks, defined here as family income, over $100,000, a clear majority, 62%, believe treatments are worth the costs.
Okay, 62%. Makes sense.
But then you look at lower-income Americans, families earning less than $30,000 a year.
Yep.
It flips. A majority there, 57% say treatments often create as many problems as they solve.
Whoa. So 62% for among the highest earners versus 57% essentially against among the lowest earners. That's a huge difference.
It really is. And it suggests, doesn't it, that how you view the value of a treatment isn't just about whether it works clinically.
It's tied to whether you can actually afford it without it wrecking your life.
Precisely. The cost, the copays, the deductibles, maybe taking time off work, the fear of debt for someone with fewer resources. That financial burden might literally be a bigger problem than the health issue itself. It reframes that whole 51% number.
Yeah, it definitely puts a different spin on it. And this focus on cost, it leads us right to the one area where the survey found, well, almost everyone sees eye to eye.
Absolutely. If there's one unifying theme in how Americans view healthcare, according to this data, it's the cost.
So what was the number?
A huge majority, 83% of Americans, say the high costs of medical treatments making quality care unaffordable is a big problem.
83%. That's massive, and it cuts across different groups.
Completely. The source emphasizes this agreement holds regardless of income, age, race, ethnicity, education level. It's pretty much a national consensus on this point.
And politically, too, because healthcare policy is usually so divisive.
That's what's so striking. Even politically, there's strong agreement. About 81% of Republicans and 85% of Democrats see the high cost of quality care as a big problem.
Wow. So nearly identical levels of concern across the aisle about affordability.
Yeah, it's quite remarkable in today's climate. They might disagree profoundly on how to fix it, but they overwhelmingly agree that the cost is a big problem.
So this concern about cost is almost universal. But the survey didn't stop there, right? It asked about other potential problems, too.
It did. Beyond just the price tag, people flag several other issues as big problems, and the percentages are quite high for some of these as well.
Like what?
Well, for instance, 68% over two-thirds think people rely too much on prescription meds that might not even be necessary.
Okay, that's a lot.
And 59% say the side effects from prescription medicines often create as many problems as they solve. So again, that creating problems theme comes up.
What else?
Nearly half, 49%, worry about the slow pace of evaluating treatment safety and effectiveness.
Okay.
And 46% think providers are too quick to order tests and procedures that might be unnecessary.
Anything else stand out?
Yeah, a couple more. 44% are concerned that new treatments get rolled out before we really understand their effects.
Right.
And 42% feel that new treatments are just so complex that patients can't really make informed choices.
So it's a whole range of concerns, overuse of meds, side effects, speed of approval, complexity, maybe unnecessary care.
Yep.
It's not just about the sticker price.
Exactly. It paints a picture of unease about how medicine is practiced and regulated, even beyond the financial aspect.
And you mentioned earlier that on some of these points, unlike the cost issue, we do see differences between groups.
That's right. The source highlights one area in particular, that concern about new treatments being made available before we fully understand how they affect people's health. Remember, 44% overall saw that as a big problem.
Okay, the 44% one, how does that break down?
Well, again, income plays a big role. Among lower-income Americans, under 30K, 55% see this as a big problem.
Over half.
Yeah, but among upper-income Americans, over underdoggins, it's only 27%.
Wow, that's less than half the rate. A huge gap, 28 points.
Huge gap. And we also see significant differences by race and ethnicity.
Tell me about that.
Larger shares of Black Americans, 57%, and Hispanic Americans, 60%, view this premature rollout of treatments as a big problem, compared to 38% of white Americans.
Okay, so notable differences there too.
And one more gender. Half of women, 50%, see it as a big problem versus only 38% of men.
So lower income, Black and Hispanic Americans and women are all significantly more likely to worry that new treatments are coming out too fast before we really know the effects.
That's what the data shows.
What might be going on there? What does that suggest?
Well, it could point to different levels of trust in the system, perhaps, maybe based on historical experiences, or feeling like you don't always get the full picture from the healthcare establishment or regulators.
Like maybe some groups feel more vulnerable or experimented upon.
It could reflect something like that, or just a greater sense of caution based on their interactions or community experiences. It suggests that perceptions of risk and safety aren't uniform across the population. It adds this layer of maybe unease or skepticism for certain groups.
Okay, so let's try and wrap our heads around this whole picture from the Pew survey. We've got this deep appreciation for the science of medicine.
Right, that 90% number.
But then this fundamental 50-50 split on whether treatments are actually worth it, with income being a huge dividing line there.
A critical factor. Right?
Then this overwhelming cross-cutting agreement that high cost is a massive problem, making quality care unaffordable.
The big unifier, 83%.
And alongside that, widespread concerns about things like prescription overuse, side effects, the speed of new treatments, complexity.
Yeah, a whole basket of related worries.
And those specific worries about new treatments coming too fast show up much more strongly among certain demographic groups.
Lower income, Black and Hispanic individuals, women. Yes.
So what's the big takeaway here? What does this tell us about how Americans see healthcare?
I think it shows a public that's really quite sophisticated in its views, actually. They can hold seemingly contradictory ideas at the same time. Like appreciating the miracle of scientific progress in medicine.
Yeah.
While also being deeply worried about the real-world consequences, the cost that makes it inaccessible, the potential harms, the feeling that maybe things are moving too fast or too complicated. It's that paradox we mentioned at the start.
Hope mixed with a heavy dose of caution and frustration.
That sounds about right. Hope in the science, frustration with the system, and caution about the application, especially if you feel vulnerable financially or otherwise.
Appreciating the potential, but really wrestling with the reality of it all.
Exactly. The potential versus the practical reality.
So, to sum it up for everyone listening, Americans seem remarkably united on one thing. High costs are a huge barrier to getting good health care. That bridges political divides.
Definitely the clearest consensus point.
But beneath that, views are much more divided on whether treatments are ultimately worth it, and your income heavily influences that calculation. Plus, there are these other significant anxieties about how medicine is delivered and regulated, anxieties that resonate more strongly with some communities than others.
Which leaves us with a really interesting final thought, drawing straight from this data.
Yeah.
Given this landscape, the strong agreement on the problem of cost, but these differing views on treatment value and the pace of innovation, especially varying by income, race, gender, what does this suggest about the priorities people bring to the healthcare debate? Meaning, it seems like people aren't all focused on the same thing. For some, the primary lens might be affordability. For others, it might be access to the absolute latest cutting-edge therapy. For others still, it might be caution, wanting more proof of safety and long-term value before embracing something new.
So it's not just one problem, but maybe multiple, sometimes competing priorities all wrapped up in that single word, healthcare.
Exactly. And this survey kind of unpacks that complexity in the public mind. It's definitely something